Thanks for coming back for the news at 5:30. I'm Colin Mayfield.
And I'm Vanessa Rufus. Tonight, there is a new effort to curb the rise in violence against healthcare workers. Federal data shows this group is 5 times more likely to experience workplace violence than workers in other industries.
It's a concern for lawmakers, too, who passed legislation to address violence inside emergency rooms. WCNC Charlotte's Lexi Wilson has those details for us.
This legislation requires hospitals with emergency departments to do a couple different things. One of them is to have a law enforcement officer on site at all times. Mecklenburg County Sheriff Garry McFadden says it's something that could make a difference. Hospitals are where we go when we're sick or hurt and need help the most. But some people in that most vulnerable space take out their frustrations on healthcare workers.
There is violent confrontations at the ER, and I can tell you that the ER staff, the nurses and the doctors, are not there for the violence. They're there to help.
The odds of getting hurt on the job in the ER are pretty high. Those injuries coming from violent patients, some with mental illness, maybe too much stress or under the influence of drugs and alcohol.
The safety of our nurses and doctors and healthcare workers at the hospital needs to be our #1 priority.
These days, there's a growing number of healthcare workers who say they're under attack and need the law on their side. Now, a new North Carolina law aims to help address that by requiring hospitals with emergency departments to have a law enforcement officer on site at all times, unless they get local officials to approve an exemption.
I think what the ER staff would love to see people who are armed. Probably 90% of the security personnel at these facilities are not armed.
Sheriff McFadden believes this may bring comfort and peace to emergency departments, a place he spent a lot of time when he was a homicide detective.
I can tell you many times as the medical staff is caring for a person, they find a gun, they find a knife, a magazine falls on the floor, bullets fall on the floor. Sometimes it gets a little violent because people are arriving with a lot of emotions.
This new requirement is set to take effect in 2025, but McFadden says many logistics need to be worked out.
We want to make sure that these people are properly trained, properly licensed to also handle that. And so I think that we need to start these conversations now.
The law also calls for emergency departments to report violent incidents to the state, as well as training employees in violence prevention. Reporting in Elizabeth for WCNC Charlotte, I'm Lexi Wilson.